Hello, everyone. I want to welcome everybody to Her Health and what we're talking about from an unveiled perspective, global voices. I am Grant McGaugh, and I am honored to stand alongside my brilliant co-host and global health advocate, Shara Lewis Campbell. And today we are pulling back the curtain on a topic that affects every household, every body when it comes to healthcare. Most importantly, who pays the price when systems fail? And how can we together demand better for our women and families and entire communities? So stay with us. I want you to drop your questions in the chat and let's make this a conversation that doesn't stop here. And I want to welcome everyone to Her Health Unveiled Global Voices. Let's get started. Sherry, yeah, I know you're over there in London. It's a little bit later than it is here in the US, but we always appreciate that you take the time out of your evening to share with us. So first, Cheryl, just introduce yourself a little bit, and then let's get started with something a lot of people assume, and I'll let you lead into this, and that is NHS, meaning the National Health System, healthcare really free, or is there more to the story than the public should understand? What say you?
Yeah, well, as people may have learnt from last week, my name is Shara Lewis Campbell. You'll see it displayed as S. Lewis Campbell because that's my pen name as an author. I think last week I said I've written about 16 books, and I've stopped counting a long time ago, to be very honest with you, but it's about around that figure in my last estimation. I'm also the proud owner and founder of Re-Ink Publications, which is a multi-award winning book publishing company, which I'm very proud of. And I've had that for about 6 years. And prior to any of that, I've been working in the healthcare space. And I think last year I said it's been about just over 10 years, but it's actually been a lot longer than that. When I was doing some further calculations, it's actually, I would say, probably about 16 years in total, and as we do this, it's growing, so I'm very pleased about that. And it's something that I've always maintained an interest in, especially in periods where my health or my family's health has been impacted, so I've always sort of, whether I've been in the industry or involved in it or not, I've always kept focus, of what's been happening within the health landscape. So, that's me in a nutshell. In terms of whether it's free or not, I think there's a lot of misleading information about the National Healthcare Service. People receive free healthcare, but they also pay for it. It comes out of their taxes as well as their national insurance, so that's where those contributions go to. And without those contributions, you don't get it, you wouldn't receive it here. There is also the private healthcare. And in terms of the NHS system, my latest figures tell me that it was around 1.73 million, which is like the highest taxes that we've seen being paid, yearly into this service. So why is it that over 700 million people, are still are waiting in waiting lists for treatment? I mean, the numbers are just getting more and more exorbitant as the years go on, and people are having to leave these waiting lists for those that can afford private treatment, and having to go that route, in order to get care and get the healthcare that they require, because they can no longer afford to wait in pain, wait in vain, and it's actually costing lives, because people are not receiving the adequate treatment in time. Moreover, if you come from a disadvantaged group, it's kind of like it's neither it's very likely it may not happen for you for some time.
All right, you said some light here, difference between healthcare in the UK, healthcare in the US. You're talking about an enormous wait list. It's something we're not. I mean, we do have to wait in the US for certain kinds of appointments. There's no doubt about it. Depending on what it is, they could push you out a couple months, depending on the severity of the situation. But there's definitely some differences in the UK with the US, we always in the US, we debate this all the time. Should we have universal health care or should we have private health care? And it goes either way. There's always a monetary stigma attached to both sides of the story. But I like to understand more. You have this in the UK. More and more people in the UK are turning also now to private care. Like, hey, you have a free healthcare system, so to speak. You do pay for it through taxes, but you're turning to private care. Why is that happening? And what does it say about the state of the NHS today?
I think it shows that there are large gaps within the NHS system. We need better transparency because we are not seeing how those funds are being used, in terms of the healthcare that patients are receiving. There needs to be greater input from marginalised groups and also from those communities as well that are having a say and their voices are being heard within this infrastructure of healthcare and how it's being provided. So I think there needs to be sort of greater care and focus in that area. What we are seeing is that for those that can afford to have private healthcare, especially in this country, they're not having to wait for long periods, etc. The difference between that and the private healthcare system in the US, from what my research tells me, my own interpretation, and my previous sort of experience, within this industry, tells me that it is you do receive a better private healthcare service than we do currently. However, because it's paid through sort of medical insurance, etc., what that does mean is that at times businesses may go bankrupt, by not being able to sort of keep up with the demand, of those payments, of those high costs. Whereas in the UK, you have the option, to either wait, if you can't afford to go private, or if you can afford the private healthcare, you can also go that route. But what that does is it then creates a two-tier system, where you've got those that can't afford to pay having to wait, whereas those that are in a position to pay have more choice, So, and from someone who has experienced both sides of the coin, it's disheartening when I'm receiving free healthcare advice from, the same doctor that I will pay to give me the same advice that I've just paid for, kind of thing. So, and I think that there's also sort of like a misdistribution about the way that care is even provided within the hospitals as well, because the staff who are very dedicated and committed and are some of the lowest paid workers in the country, and yet they're providing this care, and how demanding those roles are. And there's such a shortfall as well of specialists, that we need. We've seen a lot of young doctors coming through, the service, and it's all kind of Google based, often is a case, I'm seeing a lot of, if you're seeing a lot of young doctors in the service, and they're on the keyboard, looking up treatments and what's the best thing. And I'm not saying that they're not going to find the information, but it's a different way of prescribing healthcare, than what I've known in the past, and I'm not saying that things don't develop, of course they do, but the reliance on that I do find slightly overwhelming. Maybe it's my age, but I'm a little bit shocked by that.
No, I think I'm gonna agree with you along those lines. Just there's certain age groups. We have 5 generations of people now especially in the US workforce. I'm sure it's probably the same in the UK. So you have different ways of looking at things, or the expectation of service. You're probably used to, one-on-one. This doctor comes in, they evaluate you, then they write some scripts down, and then you go get your prescription. You're just not, so this whole, I would say technology age now is a different way of administering the healthcare
I
system. So
agree.
good, bad, or indifferent, it's just a change. How do we get used
Mhm.
to that change? Now, one thing I want to go back to, and that's those wait times. Wait times is important because speed of delivery and depending on where you're at in your healthcare life cycle, let's just say, wait times can be very, very serious about that.
Mhm.
You might not
Mhm.
have time to wait. How serious are these delays in the national healthcare system of the UK, the NHS as they call it, and who ends up suffering the most, in your opinion?
The patients, they end up suffering the most because they're the ones that are being greatly impacted. Not only are they sort of going through debilitating illness, if you're from a marginalized group, you're going to be treated even less seriously, than those outside of those groups. You might find yourself even further down on the waiting list,
Mhm.
unfortunately, because you possibly don't meet the criteria, in terms of, where you're situated in the waiting groups. God knows how they make these decisions, but that's why there is a greater need for transparency. I've seen a lot of, or have worked with a lot of disillusioned, colleagues, within the healthcare systems. They're not in agreement with some of the improvements or changes that are being brought into practice. There is a balance. It's needed. We have to keep on ahead of the trends, in terms of technology and surgeries, etc. And in education. Um, and that does need to be a priority. However, I'm not certain that with the way that some of these services are being phased in, especially in this country, and as a service user and provider, I do think that there's a lot that could be done in that area. For example, lots of our medical doctors' practice have all gone onto this online triage facility, which means that you can no longer ring the doctor to speak to them about anything. Um, when you call, you're listening to about 10 minutes of nonsense about why they can't take your calls, that you've got to be doing this online. But what about the 95-year-old woman that doesn't have a smartphone? Her having to listen to all this nonsense, just when she wants to just speak to someone, a person. And even when you go into, because of the triage system, I think it creates a greater distance between the administrative staff, that are supposed to welcome you when you come into this surgery, rather
Yeah.
than them see me. I think it's created a greater distance, and
This,
I know that there is a lot more focus now on patients, being more accountable for their own healthcare, and in terms of diet, etc., nutrition, and things of that nature. However, I do feel that some of these systems leave a lot to be desired and do need greater focus for improvement.
well, let's, if you don't mind, from your lens, your experience with the healthcare system in the UK, you've seen them both, whether it's the NHS or the private healthcare system, or if you might have even heard of what's going on in the US. But in your particular experience, have you had to experience these wait lines, these wait times? Has this been cumbersome to you? How has it been either a benefit or a challenge in your particular case?
Mhm. Um, yes, I have been, and on more than one occasion, to be honest with you. I have never spoken about this publicly, so it's hard for me. But I think probably I've had two sort of like serious situations in terms of my own health. One of them was quite recently, earlier this year, which was a suspected stroke. And until now, I still have not even had and this was back in March, end of February, March. And even now, I still don't know fully what was it? Was it a stroke? Was it a suspected one or not? I don't even know the outcomes. And when I was speaking to my doctor quite recently, the communications between the hospital and the doctor, there seems to be some sort of broken link there, because neither can explain, exactly what it is, all these weeks later. But I think even more significantly than that is that at the sort of tender age of just 34, which was many, many years ago now, I went through a full hysterectomy, which meant that I could no longer have children naturally. It's been the biggest change in my life that I've ever gone through, and still sort of impacts me to this day. Um, I don't even know why so much so, because naturally, probably at the age I'm at now, I think medically people can still have children at this age, but they probably are looking at grandparenthood as I am experiencing at the moment, which is an experience within itself. But when I went through the hysterectomy leading up to having the operation, it took a year and a half to diagnose me. So I went through, all this illness. I went through so many different changes within my own body as well at the time that was not being explained. The amount of pain that I was in was just exceptional. Unable to sleep, it affects every area of your life, being unable to work, so I say that to say this, there needs to be greater sort of support for families, for people that are going through these kind of maternal changes. There also needs to be more support as well, and greater understanding in terms of employers as well, because when you physically cannot get out of bed, that's the only time that I'm unable to work. So I've had other illnesses, but I've still been able to continue to work, as usual. But in terms of this particular illness that I had, my surgery was so complex and was so complicated. They didn't actually have a surgeon attached to the hospital at the time that I was with to perform the surgery. The surgeon had to, and the reason why my surgery was so complicated was based on a previous surgery that I had in my young teens, which was like I had my appendix removed. And that had created so much scar tissue around my other organs, which is why I then had to end up with this full hysterectomy many, many years later. And as I say, they didn't have a surgeon available in this country attached to that hospital. They had to use taxpayers' funds to fly in a surgeon that could perform it from South Africa. I met her 3 times. The first time to talk to me, to introduce herself and tell me a bit about the procedure. The second time was after I'd gone private because I wanted a second opinion. And then I met with her to say that I wanted to keep, at least I begged, to keep one ovary. And she told me, no, it was just not possible, So I had a full hysterectomy, which meant I had everything removed up to my cervix. And yes, I am saying this publicly because I think it's very important for other women that are going through this and never get their voices heard. So this is my time to do this. So yes, I've gone through that. Thankfully, I already had a child, and through because of her, I've been able to have experience grandchildren. So I didn't want to have children, any other children after I had my first. However, what was very important to me was that I was able to have the choice, and that choice was denied because of the delayed diagnosis and other complications. Even prior to having the full hysterectomy, I had requested keyhole surgery because I wanted to see if they could just do it as a part of an investigatory method, and it was unsuccessful. So 3 months later, I would then have to have that other surgery. Because of the delays in being able to be diagnosed, etc., and all that comes with that, it actually took 365 days before I was fully recovered. So that's the impact that it had on me.
That's an ordeal. And
yeah,
what you described there, that there was some choice, lack of trust, there's different systems. I mean, the delay, and then not knowing had to be definitely unacceptable in your mind, because that's just a long time, not the ability to work. Big question I have now: do you feel that the system was empathetic to your situation?
No, I don't. I don't think overall. I think, in terms of the surgeon, very empathetic and understanding, but very forthright in their opinion. And if they were going to carry out the surgery, they were going to do it on their terms in order to save my life. I was, internally bleeding for a year and a half. So something needed to happen. And I didn't even find out what the diagnosis was until after they had done the surgery. And then they did their own investigations after that to learn that I had ended up with endometriosis, but I didn't know I had that throughout the time that I was waiting for the diagnosis until post-surgery, and not just to say on that subject, I want to say that, that was when I was at 34. A few decades has come and gone since since that treatment for me. And most recently, my own daughter has just still recovering from delayed diagnosis on a ruptured abscess that she didn't even know she had, and had been to the hospital on 3 occasions. It was even hard to get an ambulance. At one point I had a district nurse here, and they had to override the emergency services, who was refusing to send an ambulance out to bring her to hospital at the time, even though she was going through this, because, obviously, they've got the experience. They should have been able to pick this up. But the district nurse was with me at the time and realized that, this just was not going to be acceptable, and had to use her position to override their decision so that we could get an ambulance to treat my daughter in an emergency. Otherwise, she would have either lost her life or she would have lost her leg. It was one or the other. So, thankfully, that all kind of worked out as well. So not much has changed, in terms of the service, the quality of services that we are receiving. We're not being listened to. We're not being heard. It's only if you've got somebody standing right in front of you that can see the distress that you're in. Otherwise, it's like you're having to beg, for a service that you pay for, that you're being taxed twice for, and that you're having to more or less convince, someone on the phone to receive. And
This is
can I just
important.
also
Thank
add
you.
as well,
Go
Grant?
ahead.
Sorry, I also just want to add as well, and this is for someone who works in the service, okay? Worked for the emergency services as well, has received commendations for the work that I've done in those services, okay? So this is by no means acceptable.
Glad you brought that point up because you've been on the other side of the ball. I think in the U.S. we need to understand because we're grappling with, hey, we need nationalized healthcare, or we need to stick with our privatized system. But understanding what the experience is really like, and you're speaking obviously from your own personal experience, what it's like in the UK, and that it seems to me what you're saying that there is some lack of choice there. There could be some major delay there, but yeah, you could go come out of pocket, which is kind of weird. Like you said, double tax. You're like, I got to come out of pocket to get healthcare because I can't get it in time to the healthcare I'm already paying for through a public system. That's a wow factor. What would you tell the U.S. citizens right now? Like, hey, we're trying to debate this kind of thing. I mean, what do you think they should need to know about what it's really like in a universal healthcare system when you also have private care?
I think there needs to be more clarity, around the two systems. We call it one thing, we say it's free, but, you can go and access it and it feels like it's free, but you've actually paid into it. So it's actually, how is it free? So, and where is the definition between that and the private healthcare that you actually pay for out of pocket? How different are the services? I would like some more clarity on that. There needs to be greater transparency, in relation to that. I think in terms of my advice, don't accept a 2-tier system. There should be one system that's available to all, and they receive the same equal care, irrespective of which group you may belong to.
That's important. Now we're talking about grouping, right? And different, and we've said this, and the statistics bear this out, and it is deeply troubling. Now here's the direct question: why are Black women. We're talking globally, Black women, both in the UK and the US, still dying at such higher rates during childbirth. You just kind of went through some of the things, um, in the maternal world. What do you think is going wrong here?
I think there's a lack of understanding, which creates a lack of trust. I think that, and especially around some of these sensitive issues, in terms of mental health and things like that, I mean, it seems to me that the treatments for people in marginalized groups and for Black, especially for Black women, we still have the greater mortality rates. I think it's 1 in 4, females will lose their lives, in giving birth, so today, which is even higher than in the US, so what does that tell you? We are still not being heard. We are still being marginalized. We are still not being prioritized, and we are still not being understood and listened to. And this is historical. When are we going to see change? We can only see change by involving those groups, and having them assist in making those decisions about their care, the care they receive.
Wow. We've got to get involved,
Yeah.
and really, roll up our sleeves a little bit and really understand why these numbers are the way they are when they should not be in a modern society. Let's put it like that.
Yeah.
In modern society. Now, some people believe, and this happens in the U.S. too. We pay for health care. There are certain forms of government assisted care, Medicare, Medicaid, all that kind of stuff. But then there's concierge services too. Yeah, you pay if you're a person of wealth, you can get concierge service, which is a private
Mhm.
care system. Some people automatically believe that this is better care because because you're paying more for it. You think it should be better.
Mhm.
I want to see, do you agree with that, or are there hidden costs that we need to talk about?
I think there are hidden costs. I mean, I think the in terms of the US, the amount that's spent on healthcare there each year is like trillions, in terms of the investment, that they receive. So I think they can overall pioneer, within that sector. And in terms of the quality of treatment that is received, I think it's probably better than anywhere else. Um, However, in terms of accessibility, I think that's where the issues are. And as a result of that, again, we see the marginalized groups, affected because they don't have access to it, because of their social impoverishment. So therefore, they're never, they're going to die earlier, unfortunately. They will face the same issues in terms of high mortality rates. They're not being listened to, they're not taken seriously, and we see it in many other areas, of life. So we need to speak up more. We need to advocate more. We need to support, Black females, in receiving better healthcare, and we all need to champion this. And we need to, do this in a make it a global combined effort, to put pressure on those that make these decisions. Um, and I think we also need to campaign more. And there are global groups out there. Join them. If this is something that's of interest to you, and is something that's where you'll be impacted or family members are. And I think especially in terms of maternal care, it really does affect Black women. Quite greatly. And I think there needs to be more emphasis on that. And there needs to be more emphasis as well from Black females getting involved in this area as well and advocating for better healthcare for females.
This is so important. I know we talk about these things and these little small windows of time of a half hour. That's why we made this a 6-part series. We had the first series, we had the second series. I think next week we're even going to talk about something we talked about earlier this week around you have artificial intelligence, but if it's still being developed by predominantly white male men and that they are not taking into account or they don't even understand the female perspective, let's say. Now you're starting to have robots and machines that are programmed. They're more male centric than female centric, let's just say. And their
Yeah.
diagnosis, let's just say, of what is right and what is wrong. We're depending on this. We have to really understand this. And if we don't look at the programming of these types of systems in at their core root, this could be a continuous problem. So we've got just a few seconds here, Shar. Let us know what we think we can see for next week.
Yeah, I think we need to see how that's going to impact, the female groups, in terms of the healthcare that they're going to administer. How can that be if we don't have a female voice? If the female voice isn't understood already, it'd be interesting to see the research that's being done around that. I'm starting to think that it's also sounds like it's set to be a failure before we can see anything successful out of it, at this rate. So I think there needs to be a lot more work done in this area, and we need to hear a lot more female voices within this arena.
I think you're right.
Otherwise, I
If you
can't
don't
see
raise
how
the
it's going to
you don't
work.
raise the voice for level. Right now we got global voices. Or we don't raise that voice level, it doesn't get done. It doesn't get done in these major systems and tech companies that are developing these software. A lot of times they're just looking at these almost like a child playing with a toy. And he's like, oh, this is great. We can do this. This is great. But not understanding the human implications. This is so important to understand. So I want to thank you again for being with us this week. Look for us next week. We're going to dive in deep again on our third episode on Her Health Unveiled Global Voices. Thanks again, Shara. You take care.
Thanks for having me.
You're welcome.